medical school interviews are rough, and a lot of medical schools nowadays are implementing ethics or MMI questions into their interviews. They want to see if you are the perfect candidate for them and how you're going to answer through a very tough ethical question. So in this video, I'm going to cover an ethics question. I'm going to dig deep into it, how you need to answer it, so to make sure that you can ace your ethics question on your interview. And for those of you that don't know me, I'm Kartik Goswami. I'm a third year MD student in Northern California. I've gotten accepted to over 8 different medical schools, and it was all down to the interview. And I sat on admissions committees, interviewed many candidates, helped them get in. On top of that, I used to have a website, thedoctorjourney.com, where I helped many people prepare for the interviews and ace their interviews. So without further ado, let's get into it. A lot of people struggle with the ethics questions. They are probably the hardest questions to answer. Ethics questions you can't really get right as well. There's wrong answers for sure, but there's no real right answer. So for ethics questions, you just gotta keep practicing them. I'll leave a link below of a Seisman website below. They have like 100 different MMI ethics questions, same thing. Go and practice those, make sure you do a good chunk of them so you kind of know how to answer them. But I'm gonna go through it right now. I'm going to tell you guys how to answer an ethics question with a prompt. Now keep in mind, some schools do have specific timings and how long they want you to answer. For example, my school, they said you have a maximum of 5 minutes, and they kind of wanted us to talk for the 5 minutes. So I had to practice talking on these ethics MMI questions for 5 minutes long. Other schools might have like a 3 or 4 minute limit, and aim for practicing around 3 to 4 minutes. I think that's a good amount of time to answer an ethics question really properly. Also, key point on these questions, the interviewer doesn't expect you to know any medical knowledge, any scientific, any legal stuff right now. So just go to the best of your ability, best of your knowledge. It's just about answering these 4 different things. And the 4 different things are your 4 rights to healthcare. This is probably the 4 most important things you need to mention within your ethics question. The 4 most important things are beneficence, which is do good, non-maleficence, which is do no harm, autonomy, let the patient decide what they want for themselves, and 4th one, justice, make sure everyone is treated equally and everyone gets a fair advantage. So those are the 4 tenets to healthcare. I have them up on the screen. I'll link them below in the description as well. Make sure you incorporate those somehow into your answer. If you can't do all 4, incorporate a couple of them in. It shows that you really know the rights of healthcare, rights to patients, rights to treating people. Make you look really professional, make you look really good in your ethics question. So without further ado, let's get into a quick example. I won't do a full 3 or 4 minute one, but I'll explain a little bit. So I'm gonna read this off my laptop, so I'll be looking over there. A 21-year-old female presents to the emergency room with vomiting, fever, and headaches. You realize that this is not a common flu, but is likely bacterial meningitis. She doesn't believe you as her symptoms have gotten better after resting a bit. She refuses treatment and decides that she is going back to her college dormitory. What should you do as a physician in this situation, knowing that bacterial meningitis can lead to death or permanent disability? So if you didn't get that, it's right here on the screen. You're probably reading it with me right now. So kind of a complicated prompt, right? This girl is, dealing with a very serious condition, can lead to her death, but she doesn't want to get treated. What do we do? Well, when you're answering this question, do exactly what I just did, but a little bit longer. Summarize what you got from the prompt back to the interviewer. Not only does this make sure that you understood it correctly, it also wastes a little bit of time. And usually these are timed questions, and you want to waste extra time as much as possible. Just shows that you got the right answer down as well. It just gets you in the zone. You summarize the thing and then you dive into it. So you got that summary, Dean? So this lady's dealing with bacterial meningitis. What we want to do is beneficence, to do good for the patient. We want to treat the patient, make sure that she gets better, But at the same time, not giving her treatment would be non-maleficence. So because that's doing harm to the patient. So we don't want to do harm to the patients. We want to do good to the patient. So we want to do beneficence. But at the same time, this patient is saying through her autonomy, which is her right to choice, that she does not want any treatment. So we got to be like, okay, we want to do good. We don't want to do harm, but at the same time, we got to respect autonomy. But then bacterial meningitis also is a disease that could possibly spread to others, maybe go to other people and kill other people, right? She said in the prompt, it said she's going back to her college dormitory. So if she's going back and this is a contagious type of disease, we don't know. Scientifically it is, but I'm going off of what I would have known a few years back, and I didn't know it's contagious. But anyways, if she goes back to the college dormitory and it is a contagious disease, she eventually could spread it to other people, and then wouldn't they be in the same situation of dying? So for justice, shouldn't we give everyone an equal opportunity by making sure that this exact patient is treated before she gets back to her college dorm? Or if she doesn't want to get treated and we want to respect her autonomy, but we want to do justice to protect other people, should we isolate her, let her heal on her own? And then I would expand like that. So I mentioned the 4 rights to healthcare within this one prompt. I would expand on different tangents. There's no real right answer to this. The wrong answers would be like, oh, I'm gonna throw her in jail and like, I don't know, do something bad. But I can't even think of a wrong answer right now. But the right answers aren't there. Just show that you understand the situation. It's a very struggle situation. So many different like opposite things that are happening. So yeah, explain that you understand it, how you're gonna approach it, and the people who are interviewing you are gonna love it. You're gonna be like, you mentioned the 4 rights to healthcare, you're mentioning every different facet of the problem, and you know what you're doing. So yeah, that's what you need to do for your ethics question. Hopefully that helps. Go check out my other video on how to prepare for your medical school interviews. It has all the tips and tricks you need from every little detail. Go check it out, it's a good one. And if you guys have any questions or anything at all, please leave a comment below, like this video, subscribe, or you can even DM me questions on Instagram. Whatever you like, I'm there for you guys. And in the meantime, stay happy and stay healthy, everyone. Bye-bye.